Okay, welcome everyone to the evening session of Virtual ISCOLS 2020. So for tonight we have 5 papers. So this program will last until 8:30 West European time. So we will start off by discussing, or Ondrej will start off by discussing 2 of his papers. One on the reactions to planned DiscoverEU trips affected by COVID-19 and the effects of vacation cancellation on anticipatory emotions. And then we have a number of contributions from the United States or on the United States. So on how the COVID-19 pandemic sparks racial animus in the United States, a very topical issue. So one on the impact of social distancing behavior, and the final one by Ronald Anderson on catastrophic global suffering, past, present, and future. I will shortly, so after the presentation is started, put in some guidelines for presenters and for attendees. For attendees, you can ask questions after the presentation. You can do it in 2 ways. So raise your hand or ask the question in the Q&A box or in the chat box, and I will answer it for you. If you're a presenter, I will make you a panelist, and after that you are able to speak, and you are also able to share your screen with the other participants, meaning that you can share in this way your PowerPoint presentation. So let's move on to the first presenter. I will promote Ondrej to panelist, and then we are able to start our session. Welcome, Ondrej.
Hello. I guess you can hear me. Yes.
I can hear you perfectly.
Okay, brilliant. And yeah, I'll go ahead and click share screen, and then hopefully I can present. I want this one, I think. Yes.
Okay, perfect. We can screen your screen well.
Okay, great. So I'm going to go ahead and start. Now I have 2 presentations, both of which come out of a project, a data collection conducted within a research methods course that I teach with my colleagues, Coen van Bendegom and Sebastiaan Straatman. The first presentation is quite a bit longer than the second one because the first presentation has basically the theoretical background of both of them. And the way this course works is we invite students to work with a questionnaire that we create, and then they can pull out their own topics from the questionnaire. They can distribute it to different subpopulations if they want, and actually take the research in rather different directions. And for these 2 papers, I'm reporting on the findings the students made from 2 quite different populations of respondents. Maybe it's good to say that this all happens around the end of April, beginning of May. So in the Netherlands and more broadly in Europe, this was kind of the dark depths of the lockdown after the peak in COVID-19 infections in March. The first presentation is based on a more general population sample, which the students spread on social media, sort of snowball style, and I got a bunch of their friends and then friends of their friends and so forth to fill it out, and also people from the parents of their friends and that particular generation. The second study is based a lot more on a very specific age group that's undertaking a very specific kind of vacation. So I'm at the Breda University of Applied Sciences, which is the logo on the lower right. and these students study in a Bachelor of Science in Tourism, which is a joint degree between our university and Wageningen University. That's the logo in the middle. And I've been funded to research the quality of life effects of vacation behavior last year and this year by a postdoc grant from a Dutch government body called SIA, and that's the logo on the lower left. And I just want to acknowledge that that wonderful grant that's allowing me to publish off of these data. Okay. So we know from recent research from the United States that the perceived risk based on the spread of COVID-19 varies tremendously among individuals. And some people feel that there's no risk to them at all, and others are just hunkering down at home waiting for this horror to pass. And then there's everything in between. So we were interested in this perceived risk, as we call it, as a moderator in the relationship between what people are planning to do with their next vacation and how people feel about those vacation plans. Now, at the time we did this questionnaire, typically what you would have in Europe is that a person has already done some planning of their summer vacation. And to take a summer vacation is very, very common in Europe, I would say nearly universal. And suddenly those plans came into question because of the COVID-19 restrictions. So we would expect that, you know, people who felt they should cancel their vacations and went ahead and canceled them would feel pretty negatively about that, but maybe less so if they thought they were, you know, doing it in their own self-interest, that it was so risky to travel that they really should cancel their vacations. Okay. There is some existing literature on crises in tourism. The two most prominent ones that have been written about is the SARS outbreak in 2003, which really mirrors the kind of beginning phases of the COVID-19 situation, and also the eruption of the Eyjafjallajökull volcano in Iceland, which I think for about a month or so, it pretty much halted nearly all air travel in Europe because of volcanic ash, and that also has some similarity to the reduction in air travel during COVID-19. But both of these crises were smaller in how long they lasted, in how much they restricted people's movements, and that sort of thing. Unfortunately, the existing research on these crises really focuses on the economic impacts and sort of how the industry suffers as a result. But what I'm really interested in, of course, is how people's vacations are part of their quality of life. So how do people suffer when they're not able to take a vacation anymore? This is what I wanted to know. And this is really an under-researched topic. We already know that also the tourism impacts of COVID-19 are quite dramatic, and that you know, a lot of tourism businesses are struggling. But again, it's not really known what effect this has on individual people who would be taking a vacation, their quality of life. Perceived risk has also been studied in a tourism context, and 5 major risks of vacationing have been identified: terrorism, war or civil unrest, crime, health, and cultural misunderstandings, language misunderstandings, that sort of thing. You notice 4 of these 5 have to do with safety. and safety is well known to be sort of a fundamental factor in people choosing to go on vacation, sort of like a hygiene factor. You know, they have to feel safe to go on vacation to begin with. But where people perceive safety and where they perceive risk is also, just as with COVID-19, it's known to vary dramatically in vacationing based on demographics, personality, how a vacation is organized, what moment in the trip we are talking about, you know, travel to the destination, an activity at the destination, travel home, packing, whatever. The specific situation in which you simply ask people the question, the extent to which people know the risks, and the extent to which they think, okay, they are placing themselves at risk voluntarily. So that all suggested that, okay, if we ask people, you know, what are your vacation plans now that COVID has locked a lot of things down, and how risky do you think travel is with COVID, we would at least see a lot of variation, if not really relationships between these variables. Tourist emotions have been studied quite extensively, and we know that, you know, as you would expect, when people experience more negative emotions during a vacation, they're less likely to recommend that kind of experience. When they have more positive emotions during a vacation, they're more likely to recommend that kind of experience. Of course, from psychology, you're probably familiar with the negativity bias that, you know, if you experience a negative emotion at a 3 on a 1 to 5 point scale, that has a stronger effect on your behavior than experiencing a positive emotion at a 3 on a 1 to 5 point scale. There's this kind of negativity bias. And then in tourism research, there's also well documented a kind of positivity bias, that you expect vacation experiences to be more positive than they actually are. And you remember them as being more positive than they actually are. And then if you measure emotions day to day, before, during, and after a vacation, then while it's not as positive as you expected, in general, vacation experiences are more positive than day-to-day life. And by improving people's emotions for a while, vacations have become understood as an important ingredient in quality of life. And the ratio of positive to negative emotions has been acknowledged for several decades as an important quality of life indicator now, starting with the subjective well-being research of Diener, the World Health Organization scales, and that sort of research. And in the past years, it's also been uncovered that by increasing positive emotions, vacation experiences contribute to quality of life. But what if they're canceled? Well, if they're canceled, the sort of general idea that there's a crisis going around by itself could make people's emotions more negative, or perceiving a canceled vacation, especially if you thought it was safe to go, and then, for example, the airline has canceled it, could make people really upset because they could see it as a service failure, which is a concept in the hospitality literature that's really been linked to negative emotions. But there could be a sense of perceived justice in, let's say, canceling a vacation if you think the risk has been very high. Right? So we thought that perceived risk would moderate the relationship between travel status and emotional valence. So once again, the students distributed the questionnaire over social media. So they got a really young Northwest European sort of sample with a small kind of second mode in the age distribution around the age of their parents. there were 624 participants who filled out these particular items. The sample was overwhelmingly female, more than 2/3 female, and you can see in the age distribution here, the age ranged from 18 to 82, but the median was 22 and the mode was 19, right? Just like our students. So it's really, you know, them distributing it to their friends and their friends' friends and so forth. So pretty decent sample in terms of size, not so great in terms of representativeness. We measured travel status using this dummy-coded dichotomous approach. So we gave participants a couple of different possibilities of, you know, my vacation is canceled, my vacation is delayed, or as far as I know, it's going ahead as planned. And then we recoded these into, you know, vacation plans were unchanged or canceled. We adapted items about perceived risk in tourism from the Floyd and Pennington Gray paper. We adapted these items to the COVID-19 situation. And these were measured with a 1 to 5 Likert type scale. Same for emotion items, where we used the scale of positive and negative experience by Diener and colleagues. And there we just added up the positive emotion items and subtracted the negative ones to create a valence measure. And this is an interesting difference from the second paper where the students chose to analyze emotions a bit differently. About 60% of our sample was still planning to go ahead with their vacations. About 40% had canceled them. You can see, in spite of the fact that this was quite a young sample, at the time of this survey, they really perceived traveling to be risky. 3.9 is well above the midpoint of 3 on the scale, and they did not feel good about the vacation coming up. The emotional valence was slightly negative, just below the midpoint of 0, so negative about 1.2. So again, the item asked them, when you think about your upcoming vacation, how do you feel? Clearly not that good on average. And then this slide shows the outcome of the moderation analysis. And indeed, we found that there was a significant moderating effect. In general, people who had canceled their vacation felt more negatively about it than people who thought it would go ahead. And this was true at the average level of perceived risk, but also 1 standard deviation above and 1 standard deviation below. But the higher the perceived risk, the weaker this relationship. So when participants perceived low risk, there was really a big difference in the emotions between people who had canceled and people who had not. Whereas if they, namely that's a difference of about 6 on this negative 24 to 24 scale. And if they perceived a high risk, so one standard deviation above, then the difference between a canceled vacation and a vacation that was still planned to go ahead was less than half of that. Right? So indeed, consistent with what the literature would lead us to expect, people who canceled their vacation felt worse about it than people who still planned for it to go ahead. But this effect was much smaller if they thought that traveling in the current situation was risky. So the main limitation here is, of course, that the sample's not very representative. We also thought that it might be interesting to come up with a 3-way interaction between travel status, perceived risk, and age, because now certainly in the Netherlands, in the popular media, there's a lot of discussion about, you know, if people of different ages should be treated differently to, you know, allow society to continue in a less restricted way while COVID-19 is still here. So it would have been interesting to also examine an age effect. For that, we would want a more age diverse sample. And also, you know, emotional valence is only one way to sort of crunch the emotion numbers from a nice emotion scale like this. So there's other emotion dimensions that can be looked at. So that's the end of the first presentation. I'm not sure if I should go straight on to the second one, but maybe if there's already some questions someone would like to ask.
Yeah, there's in any case one question which you might would like to answer. So in the chat box, Runjing posted a question. So just to have a better sense of the perceived risk, have you checked how the perceived risk is correlated with the numbers of deaths or cases or total or per capita in the residence and the destination of the respondents?
Well, I love this question because it's answered in the next presentation. But
Okay.
I think it's a very relevant one. Well, what we haven't looked at is we haven't looked at this question at the level of region or municipality. In the next presentation, we examine this question, among others, at the level of nations. And if we get it a little more detailed, and also not only in the residence, but in the destination, as the question mentioned, then we would see, well, how much perceived risk is there in a situation that's objectively the same? And I think that would be very interesting to see. So, so in short,
okay. Shall we then move on to the next presentation and then other questions till the end?
Yeah, sure. Yeah, so I will just click ahead if I can. Let's see, make the chat disappear. Okay, great. So assuming the same sort of theoretical framework about, you know, vacations contributing to quality of life, but there being this perceived risk in taking vacations always, but now in the current situation with COVID-19, a much greater risk. We move on to a much more specific population and a much more specific kind of vacation. And that is the DiscoverEU program, which I had never heard of before these two students, Giulia Loda from Italy and Radina Shikova from Bulgaria, brought it to my attention. And Giulia and Radina both participated in the DiscoverEU program. They both took a vacation within this program, and they thought it would be really interesting to research how COVID-19 has changed participants' feelings about their planned vacations within this program. But just like my colleague here asking the question, they also wanted to bring objective statistics about death rates and case rates into the picture. So I'm really glad to be able to just very partly answer your question with their really interesting data. So what is DiscoverEU? Well, it turns out that DiscoverEU is a program meant to increase intercultural contact within the European Union. In the European Union, you know, we have a sort of overarching political organization spanning countries that have sometimes really different cultural values and practices. That creates tension, which with different people try to address with different kinds of initiatives. And DiscoverEU is one of these initiatives, and it specifically tries to use tourism to improve cross-cultural understanding. And basically the way it works is 18-year-old Europeans, they have to be 18, very specific, 18-year-old Europeans can apply, and they have to answer some questions, and they're then eligible to be gifted a month-long train ticket, which basically they can use for 1 month to travel for free on almost any train all over Europe, right? So in terms of a vacation for an 18-year-old person, this is an amazing deal. They only have to take care of their food and accommodation, and they can just travel and see many, many countries in 1 month and have a fantastic time and get to know other cultures, hopefully along the way. So it's known from the literature that actually increasing intercultural understanding is an aspect of quality of life in its own right. But also, of course, DiscoverEU participants see this experience as a vacation. And as I established earlier, vacations are also known to contribute to quality of life. So in terms of quality of life, this looks like a really great initiative. But then COVID-19 comes along, and as we know, plans have to get canceled. So the students were curious about what effect this has specifically on the emotions about the upcoming DiscoverEU trips. So they wanted to compare the objective situation in participants' countries, specifically in terms of death rates and case rates, and see if this objective situation was related to their perceived risk. Instead of aggregating perceived risk, as with the previous presentation, they chose to look at perceived risk on a per item basis. And then they figured if a higher risk was perceived, also the emotions about the upcoming DiscoverEU trip would probably be less positive, more negative. And they also chose to analyze this on a per emotion basis. And from this 12-item scale from Diener and colleagues, there are 6 specific emotion items: joy, happiness, contentment, fear, anger, and sadness. All right, so here we were hypothesizing that there would be this sort of mediation model, that the COVID situation in this DiscoverEU participants' country would predict how they feel about their upcoming trip, and that this relationship could be partly explained by their perceived risk. These students also used social media, but they didn't use a snowball approach, so they didn't try to ask friends or friends of friends. Instead, they went to Facebook groups that were specific for DiscoverEU participants, right? So there's like 3 or 4 of these Facebook groups, and on each one they posted a message saying, can you please help us out, fill out a questionnaire about your upcoming DiscoverEU trip. And that way they could be sure that they targeted really as much of their population as possible. The sample came from 22 different countries. When you're thinking about the statistics reported later, you have to realize that even though there were 125 respondents, because we looked at the case rates and death rates per country, our effective sample size is actually only 22, because we're looking not at differences between participants, but differences between the 22 countries. You can see in the distribution, the graph in the middle, there were large numbers of participants from Belgium, France, Germany, Poland, Romania, the Netherlands, and the UK. Only one participant each from Croatia, Denmark, and Hungary. And of course, in these 22 countries, there are some countries missing, right? Which really limits our statistical power. The sample was even more biased than the last one towards females, more than 80% females. And of course, almost everyone was 18 years old, but that was sort of the point in this case. Okay, remarkably, just like the last sample, despite the differences in the population, we saw almost the same perceived risk, items having to do with risk related to the current situation was at 3.99. That's almost the same as in the other study. And items having to do with risk more generally, 3.67. So both well above the scale midpoint. So at least at this particular time, also a sample just composed of 18-year-olds really thought traveling was really risky due to COVID-19. And also they felt quite negative about their upcoming but often delayed DiscoverEU trip, right? So the scale midpoint was again 3, so 1 to 5 point scale. Positive emotions came in at an average of 2, and negative at 2.95. And again, if COVID-19 was not in the picture and you just compared these numbers to other studies, if you ask people for their emotions about an upcoming trip, the positive will usually be about 4 on a 5-point scale, and the negative will be about 1.5 on a 1 to 5 point scale. So in terms of how people feel about their vacations, also the effects of COVID-19 are really dramatic. So again, we have this very small sample size and low statistical power, and in general, we found no significant relationships among the objective COVID situation in a country in terms of death rates and case rates, the perceived risk, and the emotions about their upcoming DiscoverEU trip. We did find, though, one quite paradoxical set of relationships, which is a negative relationship between death rates, feeling nervous about traveling, and death rates and fear, right? So participants from countries with higher death rates reported feeling less nervous about traveling and reported feeling less fear. And that was certainly different from what we expected. Also, feeling nervous about traveling was positively correlated with fear. And when we ran these variables in a multiple regression, looking at the direct and indirect effects, indeed there was a partial mediation effect there. You can imagine these, according to the zero order correlations which you see here, and the fact that it's from a sample of only 22 countries, those effects had to be quite substantial to be significant. So in a country with a higher death rate, feeling less nervous about traveling and less fear about the upcoming vacation, well, how do we explain this? It's possible that higher death rates may reflect more honest or more organized counting of what's actually happening in participants' mind. So they may think, okay, if death rates are not high, something is being underreported or inaccurately reported, or we don't yet know how many people are going to die. It's kind of fear of the unknown, and that may lead to greater fear. Also, there's of course this effect that if there's pretty extensive testing and you have a peak in reported cases, then the peak in hospitalizations comes about 2 weeks after that, and then the peak in deaths comes about 2 weeks after that. So when the deaths peak, usually the reported cases are already declining for some time, and it could be that, you know, that's what participants were paying attention to, or it might simply be that participants were, you know, watching a really terrible situation in their home country. And then we prompted them to think about their vacation, and they think, oh, okay, I'm going to take the train a couple countries over, and there the situation's not as bad, right? So it could be, you know, that when they think about traveling, they think about being away from the situation in their own country, and they may be experiencing a lot of fear, but not about their upcoming vacation. Also, if you compare the current findings to the literature, again, I want to emphasize this really shocking negativity that people feel about upcoming vacations in the current situation, that it just really contradicts how people usually positively anticipate their vacations. So the crucial thing in replicating this study would be to get more countries, to get more statistical power. Also, you know, again, we adapted a vacation risk scale that had been more than 10 years old. So it would be worth to really come up with a good COVID risk scale and validate it, and to compare emotions about the upcoming trip to just emotions that people are feeling in the moment that they are filling out the questionnaire, because that could show some interesting differences. And in the end, in terms of travel restrictions, the summer turned out pretty well in Europe in terms of being quite open for people to travel. So I would imagine that a lot of these study participants actually had the opportunity to realize their vacations quite closely to how they planned. It would be really interesting to follow up. I wish we had that opportunity. And also, again, with a bigger sample, it would be interesting to not only look at, you know, what's the status of your vacation, but also to drill down on, you know, the kinds of restrictions that people experienced and what were the effects of those restrictions. So with that, I will end it here. I'm really curious about your questions, and also about the next presentation, because this you know, vacationing is one type of social process that's affected by the current situation, and I'm curious about how these other processes in the planned presentations look like.
Okay, many thanks, Ondrej, for your presentation. Are there any questions from the audience? You can raise your hands if you want a question. I've had any case in question from Ron Anderson, who asked you whether you know if your respondents were masks and also socially distanced.
No, we did not ask about their behaviors in response to COVID-19. However, in the second data set, it would be possible to, again, examine differences between countries, because, for example, in the Netherlands, basically face masks have never been a thing, whereas in Slovakia, for example, where I'm from, there was definitely a time when people were strictly required and strictly checked, and also very closely complying with face mask requirements. In the Czech Republic as well, although there I experienced this summer that, you know, basically people seem to really take up their new freedom to not wear face masks. So it would be possible to examine to some extent on the level of national differences, but we did not ask it on a between participant level. Thank you for the question.
Thank you for your answer. Are there other questions? You can raise your hand, or there's another question in the chat box by Runjing, and that is related to the first paper you presented. Mm-hmm. So perceived risk might not be fixed and can change because people's trips got cancelled.
Yeah, absolutely. I think, in fact, I would be surprised if people's perceived risk didn't change dramatically, because if you just look at, the tone about which COVID-19 was discussed in the popular media, there were definitely, Saturday newspapers that I got where it looked like we were really all under threat and it was dangerous to step out the door, and others where you thought, okay, now life can be almost normal again. Almost contradictory messages, like 3 weeks apart. And these kinds of messages in the media, and also people's personal experiences with COVID-19 must have greatly affected the way that they thought about vacationing. And so I'm almost certain that indeed the perception of risk was not fixed, and all we got with these questionnaires is like one snapshot at one moment. And I would be so curious to see how that developed. So I think you ask a very relevant question here.
Okay, thanks for your answer. Are there other questions from the attendees? In the meantime, I have a question for you, maybe not entirely directly related to your research, but just out of sheer interest when listening to your presentation. Do you have any info on how quickly people adapt to lost holidays, especially when it's a huge disappointment in terms of well-being?
That's a great question. I would say not yet, but soon, because about 3 years ago or so at our university, I created a panel, again using a snowball sample from students, but it's grown in the past years and become more diverse. And I asked them about their vacation behavior in the past 6 months, and I ask this twice a year. And I usually survey them in March, right after the winter holiday, and in September. So I believe in the questionnaire that's coming up, you're going to see a lot of people who didn't go on the usual summer vacation. And even before COVID-19, I thought that this was like a really interesting opportunity for researching the role of vacationing in quality of life. What if someone has an annual vacation habit? For 3 or 4 years, you can see every year they take the vacation, and their life satisfaction is maybe a 5 consistently. What happens to that life satisfaction if circumstances cause the vacation to be skipped for 1 year? And now we almost have like a natural experiment in this occurring. So I can't wait to answer this question in my September data collection. So thanks for giving me even more motivation.
Great. There's also a question of Professor Kelley, who asked, did you have a personality measure of risk tolerance? We would like to see the effect of COVID risk tolerance net of the general personality trait.
So I believe that the measure of risk perception in vacationing is based, if not on those kinds of measures, on the psychological literature about risk. But to answer the question directly, no, we didn't have a more general measure of risk tolerance, or something related like sensation seeking. No general personality measures, because these questionnaires, well, we find that every year they have to be shorter and shorter to get people to fill them out at all. And already we had a lot of incomplete responses. But indeed, it would be interesting to see to what extent does a person's general approach to risk, or that component of their personality, overlap with how they deal with vacationing and risk during vacation.
Thanks. Are there any other questions? So I would like to mention that apart from using the chat box, you can also raise your hand, and then I can just also put you on the screen directly. Okay. No further questions. Then Ondrej, I'd like to thank you very much for your very interesting.
Thank you.
And I hope you enjoy the rest of the conference.
Great. Thank you very much.
Okay, then I'm gonna switch the panelists around, and we go to our next presenter, Runjing. Hi, Runjing.
Hi. Can you?
Perfect.
Great.
Welcome.
To share my screen then.
Yes, and then the floor is yours.
Great. Can you see my slides?
I can see your slides clearly. Thank you.
Okay, great. Thank you so much for including this paper in the program. And today I'm going to present a joint work with my co-author, Yanying Sheng. And this paper is about how COVID-19 pandemic has sparked racial animus in the United States. So racial animus can affect welfare in measurable ways, as economists have long pointed out since the seminal work by Gary Becker in 1957. And there has been more recent work that provided a growing body of evidence that racial animus can have consequences on society. So for example, racial animus has been shown to partially contribute to the wage gap between Blacks and whites in the United States, as well as contribute to the residential racial segregation and the resulting difference in economic and population growth between areas with more versus fewer minority population. So given all these consequences of racial animus on the society, it's important for us to understand how racial animus forms and spreads, so we can come up with interventions to better cope with the racial animus, to prevent further fueling of it and to reduce its damage to society. And COVID-19 pandemic, despite being a very unfortunate global pandemic, also provides us with a natural experiment to study how racial animus can rapidly rises and spreads in a large geographic area. So risk of infection has long been argued to foster xenophobia by evolutionary psychologists. So although the COVID-19 virus could possibly originate from China, CDC as well as WHO have repeatedly emphasized that Asians are at no greater risk of spreading the virus than other populations. Well, despite this repeated emphasis, there have been multiple hate incidents against Asians that have been reported by major news outlets in the US since the outbreak of the pandemic. So this could be telltale signs that the racial animus against Asians could have picked up amid the pandemic. So the goal of this paper is to rigorously understand whether the COVID-19 pandemic has actually sparked racial animus in the US or not. if it actually has sparked the racial animus, what are the mechanisms mediating the rise in the animus? So here is a brief preview of the main findings of the paper. So basically what we found is that the local racial animus against Asians rises following the first confirmed COVID-19 case in a local area, and the salience of the purported connection between COVID-19 and the Asian population is a key factor driving this rise in animus against Asians. So now, let me get into the details of this paper. So first, I want to briefly tell you how we measure racial animus in this paper. So the usual measurement researchers use to measure population level racial animus are usually based on two metrics. The first one are based on hate crimes provided by, for example, FBI Uniform Crime Reporting System. And the second measurement is usually based on national surveys, such as General Social Survey. However, in the current situation, these two measurements, these two usual measurements, will not be available until 2 years from now. So they won't be available for us to understand how racial animus is changing right now. As an alternative, we construct two real-time proxies based on Google searches and Twitter posts, which include a very bad racial slur against Asian population, which we will refer to as the C word in the rest of the talk. So basically, for each area I in each week T between November 2019 and April 2020, we will have two indexes for each location, each week. So the first index is the Google search index. It could be intuitively understood as the weekly proportion of all searches in an area, which is a media market. It's measured at a media market level, which is just a cluster of counties. So weekly proportion of all searches in this area that include the C word, and Google automatically scale these weekly proportion by the highest weekly proportion of these racist searches in this area during this whole period of time between November 2019 and April 2020. So basically, Google search index is just a normalized percentage of racist searches in an area. And the second index we are going to use to measure racial animus is Twitter post index. It could be intuitively understood as the weekly number of tweets that include the racial slur C word per 100,000 tweets, including the in a county. So we measure post index at the county level. The reason we scale the number of racist tweets by the number of tweets that including the is because we want to account for the general change in online activity on Twitter. Because as we all know, once social distancing and lockdown happened, people start to stay at home and use the internet more. So we want to take account of that. So we scale this number of racist tweets by basically the total volume of tweets that including the most common word the on Twitter. And the rationale behind these two proxies is as follows. So basically, the assumption we need this proxy to measure racial animus properly is that higher racial animus in a local area would induce people to use the C word more often. So if that's the case, then aggregating millions of Google searches and Twitter posts will help us gauge the racial animus of a local area. And the good thing about combining both Google and Twitter together is that Google can capture the private demonstration of racial animus because Google searches are usually done in private, while Twitter, being a public social media platform, can help us gauge people's tendency to publicly display such racial animus. And I want to say that we are not the first people to use proxies based on Google searches or Twitter posts. There are past papers use similar proxies to measure racial animus against African Americans in the United States. And what they found is that these proxies could predict anti-African American hate crimes in the local area, as well as votes for Obama in the 2008 election. And in our current context, we also found that our measure of racial animus predict these similar things. So basically, we found that higher C-word searches on Google actually correlate with higher monthly anti-Asian hate crimes in the local area between 2014 and 2018. And these higher C-word Google search index also correlate with fewer monthly visits to Chinese restaurants during 2018 and 2019. So taken together, these real-time proxies of racial animus against Asians that we constructed can indeed capture the racial animus in the local area to some extent. So these will be the main outcome we use in the following presentation. So I've already explained how I constructed or how I measured racial animus. Now let me explain how I use this racial animus as an outcome to answer my research questions. So basically, the main strategy that we are going to use in this paper is a difference in differences design, where we exploit variation in the timing of the first COVID-19 confirmed case in different areas across the United States. So basically, we're going to run the following regression. We're going to regress our outcome, which is our measurement of racial animus in area I in week T, on a series of event week dummies, and this event week dummy will equals 1 if this current week T is K weeks from the first local confirmed case. In addition, we are going to include a bunch of area-specific controls, for example, case rate, death rate in the local area. We are also going to control for area-specific fixed effects to control for the average level of racial animus in this area. In addition, we are going to control for year-month fixed effect, which could help us control for the general trend of racial animus in the United States. And the identifying assumption for our study is that the exact timing of the first COVID-19 case in the local area is plausibly exogenous, which means that whether the first case is confirmed this week or the next week is largely unpredictable and should not be correlated with any other confounding factors that could simultaneously change the racial animus. And if you buy that identifying assumption, then beta K could help us identify the effects of the first COVID case on racial animus in Kth week after the first case. This is because if there is nothing else that changed racial animus at the same time as this first COVID case, then if we see a change in racial animus following the first COVID case, then we could attribute that change to as a result of that first case. So that's basically the identifying assumption of the paper and the main strategy of the paper. So now let me present our main results. So here are the main results of this paper. Let's first focus on the left panel. So here, what I do is I use the Google search index that people search the racial slur C word as our outcome. And I plot the coefficients on this beta K dummy on this plot. The x-axis just tells you which week it is, how many weeks it has been from the first local COVID case diagnosis. So 0 represents the week of the first case. And as we can see, in the weeks leading up to the first case, the coefficients are insignificant and cannot be distinguishable from 0, which means that racial animus basically stay very flat against racial animus against Asians basically stay very flat in the weeks leading up to this first case. But in the week after the first case, we see a jump in this racial animus measurement. And then it stay at a pretty high level in the 6 weeks afterwards. This jump in the racial animus measurement is about 20 Google search indexes, and it's around 66% of the baseline mean. So this jump in racial animus against Asians is pretty sizable. And now let's go to the right panel, where we switch the outcome to be the Twitter post index. And it gives basically a very similar pattern as the Google search indexes. So the racial animus measured by Twitter post index stayed pretty flat in the weeks leading up to this first COVID case. However, in the week after this first case, we see this Twitter index also jump right after this first case diagnosis. And this jump is around one racist tweet per 100,000 tweets. And that jump amounts to over 120% of the baseline mean. So this jump is pretty big relative to the baseline mean. And then the racial animus in the area slowly decreased in the 4 weeks afterwards. So taking these two parts of results together, it shows us that the racial animus against Asians in the local area indeed increases in the weeks after the first COVID case. Now you might be wondering, who are the ones that contribute to the rise in racial animus? Who are the ones that start to use this racial slur more frequent in the online world? Are these rising racial animus come from those existing races that just now start to post more about these words? Or is this rising racial animus coming from people that have not used this racial slur before, but now start to use it because of the COVID-19? So luckily, we could take advantage of the unique Twitter user ID to answer this question. And the reason this question is important because it will have different implications on the development of racial animus down the road. So basically, we could tell whether a racist tweet is coming from a Twitter user that have never tweeted this word before, which we would denote as the first-time keyword user. Or on the other hand, we could tell whether this racist tweet is coming from a user who have tweeted this racial slur before, which we would denote as existing keyword users. And then we could replicate the results we've done in the previous slide. So the blue line here represents the racist tweets coming from first-time keyword users, and the red line represents the racist tweets coming from existing keyword users. And as you can see, the majority of increase in these racist tweets are coming from Twitter users who have never tweeted this C word before. And these has important implication because a back of the envelope calculation tells us that there are over 2,000 Twitter users who have not used this racial slur before, but now start to use the C word as a result of the COVID-19. And these 2,000 Twitter users can potentially expose their 4 million Twitter followers to this racially charged content, which could have a multiplier effect on racial animus down the road. Okay, so just to make sure that the results we've seen is not because of data glitches, we've done a bunch of robustness checks. So for example, we can throw in additional controls. For example, the local area Google searches or Twitter posts that involve the keyword Asians, China, or Asians, Americans, just to control for general interest in Asia or China. And it does not change our main results. We could also exclude states that are, for example, early hit or hard hit by the COVID-19 pandemic in the United States, and our main results stay very similar. And finally, we could also run placebo tests. So basically, in our main result, we have the real diagnosis dates of the first COVID case, right? But we can also have fake diagnosis dates, which we just randomly pick from a calendar date. And we want to see whether our racial animus measurement changes around those fake dates. And we found that they don't. So all these robustness checks suggest that our results are pretty robust to different type of specification and sample restrictions. So which is reassuring. So now, after established the main finding that the COVID-19 first case indeed sparked racial animus against the Asian population, we want to know what are the factors mediating this rise in racial animus. So here in this talk, I'm going to talk about two potential factors that drive this rise in racial animus. And the first is the fear of infectious disease. So evolutionary psychologists have long pointed out that the desire to avoid infectious disease could lead to prejudice against outgroups. And in our current context, there have been surveys done in March and April 2020 that show that the majority of Americans being interviewed are very worried about contracting COVID-19. So it seems like the fear of infection risk could play a big role in driving these racial animus. And besides this fear of infectious disease, there could be another factor that drives this racial animus, which is the purported connection between the COVID-19 and the Asian population. So we will provide two pieces of evidence suggesting that this purported connection is very important in driving this racial animus. So the first evidence that we show is that the racial animus we documented is pretty much only targeted at Asians, but not at other minority groups in the United States. So basically, we could look at how Google searches and how Twitter posts change regarding the racial slurs against other minorities. For example, the racial slurs against Hispanics, Jewish, or African Americans. But interestingly, we do not see these searches or tweets regarding other racial slurs against other groups change around the local case, the first local COVID case. So basically, these Google searches and tweets stay flat around the timing of the first local case. So it seems like this increase in online racial animus against Asians is only happening against Asians, but not towards other minority groups. And the second evidence suggesting that the purported connection is very important is that we find that the salience of this purported connection really matters for the national level of racial animus in the United States. So basically, we proxy the salience of the purported connection using President Trump's tweets that mention China and COVID-19 at the same time. So in the first three columns, basically we find that the national level racial animus is stronger on the days when President Trump tweets more about China and COVID-19 in the same tweets. But the racial animus is not stronger when President Trump, on the days when President Trump only tweets about China or only tweets about COVID. And similarly, when we zoom into the hourly interval, we find similar things. So basically, these national level of racial animus against Asians is stronger in the hours following President Trump's tweets that mention both China and COVID at the same time. But this national level of racial animus is not stronger following the hours when President Trump only tweet about China or only tweet about COVID. So it seems like this purported connection between the COVID-19, the virus, and the Asian population really matters for the racial animus that we documented. So in conclusion, in our paper, we find that the COVID-19 pandemic indeed sparks racial animus against Asians in the United States, and the fear of infectious disease, as well as the purported connection between the virus and a particular racial group, helps to fuel this racial animus. And given what we found, educating the public about the dissemination of diseases, as well as delinking any purported connection between certain disease and racial groups could be effective ways to curb racial animus in the future. If you have any further comments or questions that I do not address in the presentation, please feel free to email me at this email address, and you can also find our paper on my website. So that's all for today's presentation, and thank you very much.
Thank you, Runjing. Are there any questions? I've got at least one in the chat. So I will start with that. You can also read it there. So Ondrej, first congratulate you on the fascinating presentation.
Oh,
What I like, he says, what I like best are actually your validation regressions linking the Google searches to crime, and he is wondering if you have a similar table for Twitter or similar results.
yes. So for Twitter, so it's interesting that we actually did not find a very strong correlation between the Twitter index and the hate crime during the 2014 and 2018 period, and that we think that could drive the disparity between these two different in correlation between Google. That Twitter is a social platform, and in order for people to post this racial slur publicly on Twitter, it might require a very sharp changes in racial animus for them to do so. That's why in the past, in the historic data, there's not much, like there's not huge change in racial animus. So that's why we don't see a strong correlation between Twitter index and racial and the hate crimes. But because Google is usually done in private, we don't need a huge change in racial animus to induce people to do so. That's why we see a stronger correlation in the historic data. But right now, because the racial animus change is so strong, it's so large, that we see both Twitter and Google respond at the same time.
Okay, thank you. Then there's a question by Ron Anderson, and he asked, did you measure the difference between retweets to Trump versus other tweets on the C word?
Oh, that's a good question. So you might be worried that retweeting Trump is adding to the Twitter index of the C word. But one fortunate thing about our president is that he never tweeted the C word publicly. So that's why retweeting his tweet would not contribute to the C word. And I think that's even though our president sometimes tweets other stuff, but he never tweeted the C word. So yeah.
Okay, then there's a question by Kelsey, and I will give the floor to Kelsey.
I would also like to say it's a great paper, although sad results.
Yeah.
So I have some questions that are really more about extensions. So I'd be curious to see if Trump's tweets affected racial animus more generally. And that would then affect other ethnic minorities. And so the strategy might be kind of challenging there, but it'd be really interesting. And you might also be able to characterize different regions by their racial animus. So different counties, and that could potentially be an interaction variable, although not necessary for your identification strategy now, but it would be very interesting to see the geography of your results.
Yeah, indeed. So so I didn't present in this paper, but one thing that we could do is we could split the counties or the local regions by their historic level of racial animus, and to see whether those places that harbor this racial animus a lot in the past would show a stronger response to this COVID-19 pandemic. So I think indeed this could be a useful heterogeneity test that we could see in the future. Yeah, thank you. And also speaking of whether President Trump's tweets can induce racial animus against other minority groups. So even though we haven't done so in this paper, but there are other papers that have seen that show that President Trump's tweets about Muslim seem to spur racial animus against Muslim population. So not the findings of our paper, but just to mention that, yeah.
Yeah, very interesting. Thank you.
Okay, then we have another question for you from Professor Kelley. So he asked, individual level survey work has not been showing similar effects about prejudice against Chinese Americans. This suggests that the searches and tweets are in a tiny assisted minority. This could be consistent with hate crimes, but it means that very different policy recommendations are implicated.
Yes, so right now, So would you be able to repeat the question again? So I broke up a
Yes, you
little.
will also find it if you open the Q&A box at the bottom. I think you will see it, but I will repeat it. In the video, survey work has not been showing similar effects about prejudice against Chinese Americans.
Oh, I see.
Searches and tweets are in a tiny assisted minority. This could be
Yeah, because usually in survey, people are worried because in survey, there's still like somebody asking you a question, right? Even though it's anonymous survey, it's pretty different when you like formally put down your answer. And past papers have shown that when you ask people about their racial animus, they tend to not tell you the truth. But here, the Google searches, because it's usually done in private, it can lower the social censoring level, so it could could express this racial animus more clearly.
I think Professor Kelley has a reply, but Professor Kelley, would you like to give the floor to react? I can allow you to talk on the screen, maybe to give you a reaction. Okay, you can maybe also then discuss it later with him after the session.
Yeah, we'll be happy to do so. Yeah.
Yeah. Okay. Then there is another question by Ondrej, which he asked. Yeah, surveys or still give people a feeling someone is watching. When people Google, they think nobody is watching. So more a remark. Maybe you can reply to.
Yeah, so basically that's speaking to the social censoring element of survey. So if survey is done right, then they should get rid of this social censoring element. But sometimes surveys might not take this social censoring element into consideration. But doing these searches, like for example, Google searches, is usually done in private. So it could alleviate this social censoring element to some extent. But for the Twitter, but one thing I want to note is that Twitter is a public social media platform. So if people choose to post racial slur on these Twitter, it could also tell us that people now choose to publicly express this racial animus more on the platform. And this could be due to a change in social norm, or people think it's more acceptable now to publicly express this racial animus. So whether it's done in private or done in public, I think it also matters, and it matters in different ways.
Okay, thank you. I think there are other questions. I think, no other questions. So many thanks for your presentation. Fascinating. And we go on to the next speaker.
Yeah, thank you.
And the next speaker is Professor Kelley. Hello, Professor Kelley, can you hear me? Can you unmute? That is the button at the left corner of the screen. You also can perhaps put on the video and unmute.
Sorry, I was looking at the wrong screen.
Okay, no problem at all. So
this isn't the usual computer.
Yeah.
So, okay, so let's,
Yeah.
I'm going to share my screen and take us to, sorry, I went too far. Okay, can you all see the screen now, and can you hear me?
No, I can hear. I cannot see your screen.
Okay, so let's try something else.
It's the button at the bottom of the screen.
Okay, so if we, there we go. Okay. How about now?
Yeah, I can. It's loading, but probably within. Yeah, we can see your screen clearly.
Okay, cool. Sorry for the snafus there. I'm Mariah Evans. This is a paper with Sarah Kelley and Jonathan Kelley. We're talking about how people feel about the today during the COVID experience, especially the impact of social distancing norms, the personal costs, or how people feel emotionally about distancing and their distancing behavior on their quality of life during the epidemic. Okay. No, nothing is working. There we go. Data and measurement. I can see, but I don't see it over here. So why don't I see it over here? Okay, so we are talking about some things that are possibly policy relevant because some assumptions seem to be common in the policy situation in the United States about the epidemic that are unsupported by evidence, as we'll talk. And the first is that we have shared norms or attitudes about distancing. A second one is that we have similar feelings. That we have similar emotional costs to distancing. It's just as bad for me as it is for you. We also have an implicit assumption that the impact of actual distancing is mildly negative for all. And we're going to show you that this isn't so, that in reality, there is great variation in all of these. Let's talk a little bit about our data and measurement. We're talking about survey research, 5 cohorts conducted April through August, so spanning a good part of the epidemic, although not starting as early as March. There are 126 respondents. This is a mechanical Turk sample, so it's not a probability sample, although the results appear to be very close in multivariate analyses. The mechanical Turk samples have been widely used during the pandemic, so there are a lot of surveys done that don't require any person-to-person contact or any interviewer present or on the telephone. They have proven remarkably accurate in past research on multivariate analyses in general, especially for political affiliations, attitudes, and similar issues. So the measurement happens because, of course, our results are only as good as our measurement. The distancing question is a 5-item scale about how often the respondent practices recommended distancing behavior. We've called it precautionary behavior in the questionnaire because the questions started before the unfortunate social distancing language had become established. Also that focuses respondents more on the specific questions rather than on a global, I'm a good person, so I do social distancing kind of response. So we asked about staying 6 feet away, about refraining from shaking hands, about washing your hands often, about avoiding parties, about avoiding going to other people's homes or having them come to your home, The alpha reliability for the scale is a 0.87, which makes us all happy. And the exact item wording and measurement analysis goes like this. So they begin with a STEM. Some precautions help reduce the risk that you catch coronavirus, which is what it was typically being called at the beginning of our series of surveys. And people still recognize that language. One precaution, first question, one precaution is to stand at least 6 feet away from strangers in public. Of course, not everyone does that, but what about you yourself? Do you stand 6 feet away? And we have a pretty good distribution. Only 1% of our respondents insist that they never do it, but there's a good distribution about how often they do. We also asked about not shaking hands. Again, you can see there is a full distribution from 53% who complain that they always refrain from shaking hands, all the way down to 2% who say they never do. And washing your hands after you've been out in public, 54% claim that they always do. And again, it drifts down to rarer and rarer possibilities. Washing hands, I think we just saw that. Avoiding parties is again a full distribution, and avoiding going to other people's houses also. Oops, well, we were about to go ahead anyway. Okay, so we've got the correlations among the items. You can see that they're going to make a pretty good scale from those substantial correlations, close to 0.6 for some of them. And in fact, when we do a factor analysis on them, we come out with a nice set of factor loadings with all of them very close to 0.7 or higher. When we look at the correlations with criterion variables, we're going to see that they're all of a fairly similar size and sign with the correlation with gender. And they're all negative and similar size for the correlation with African American race. They're all positive and small for the correlation with Hispanic origins, and they're all positive and about the same size for the correlation with age. So we have similar correlations for our candidate scale items with demographic variables. This is also broadly true for our SES and votes and time things for them. And down here are some other criterion variables. Knowledge of science has approximately the same correlation across all of them. Trust in medical authorities, similarly. And whether you think you can take actions to avoid COVID, similarly, and also how bad getting COVID would be for you. So when we put those together in a scale, we get a distribution that looks like this. Mostly people who think they're doing it quite a lot, and a tail off to the left. And the factor analysis, unidimensionality, when we include mask items, which we added later because in the beginning they didn't seem to be part of the recommended precautionary behaviors. We had the US Masco fiasco with the CDC saying they weren't doing any good and confusing the population. And not surprisingly, they come out a little differently on a factor analysis when we include them with those other items we talked about. So they bear some kinship with them, but there's also some considerable distinctiveness over here, which means that something else is going on with them. In terms of measuring the distancing norms, the attitudinal support for distancing, we get one factor, and including some of these issues about working from home and self-quarantining that are behaviorally distinctive. So they're not part of our main distancing behavior syndrome, which emphasizes the sort of public kind of behavior. There was 7 questions with an alpha reliability of 0.9. And the ones we asked were, considering the way things are here in this town this week and balancing the good with the bad, what do you think about these distancing policies for reducing coronavirus risk? So we're asking people what policies they think should hold in their area there, and beginning with the standing 6 feet from strangers. You can see that the balance of opinion is in favor of precautionary policy, in this case 6 feet away, although there is a distribution of the all the way across. We also asked about the emotional cost of distancing, feelings about distancing. This was inspired very early on by some of the Swedes saying they did it anyway, so it was no cost to them. And we thought this was very different from some of the other social groups in the US. So we asked about it. There are several distinct aspects, it turns out, in the analysis. There's civility disadvantages in everyday interactions. Those have to do with the shaking hands, the staying 6 feet apart and things like that. There are social deprivation of family and friends from avoiding visiting and such. These are higher emotional cost items. And self-quarantining, which is for many people a high emotional cost item. Some of the example questions in our measurement are thus, and the STEM is quite apart from attempting to reduce the risk of infection. Some of the precautions we take against coronavirus have their own infections and own disadvantages. Leaving coronavirus aside for the moment, how do you personally feel about standing 6 feet away from strangers in public? For you, is that bad in and of itself? The answer categories are on the traditional delighted to terrible scale that were asked about all these items. So 6 feet away, not shaking hands, washing our hands, not being able to eat out, not going to parties, not going to visit friends, and then the self-quarantining questions as well. And what we see is that the factor analysis separates out what we might call the civility or the civic items of dealing with strangers, 6 feet apart, shaking hands, not shaking hands, remembering to wash your hands, and then more the sociability ones with people you know or hope to know, some of them. And those are sitting together in one group. The staying home questions have something in common with the social networking questions, but they also have an element of distinctiveness. So we are then going to build a couple of scales, one having to do with foregoing the casual interactions, that's the civic behavior, and the other is foregoing the eating out, visiting, and parties. So the civic casual interactions, one is the red. You can see it's a lower emotional cost in general. The social deprivation, the foregoing eating out, visits, parties, and so on is in the blue. And you can see those are higher cost to most people. There's a substantial overlap as well. Let's look at the results. We looked both for quality of life at life satisfaction and happiness. And later on, we will use them as a combined scale, but I should mention we've run the results separately for each of them as a dependent variable, and the results are very much the same as they usually seem to be. So an important thing to notice is that life satisfaction has not much changed during the epidemic. We have the satisfaction before the epidemic in the blue, and the satisfaction during the epidemic in the red. There's certainly no decline in satisfaction, possibly a tiny increase. With happiness, looks to be largely the same story. Blue before the epidemic. So at both times, of course, most people are moderately to quite happy. We see essentially no difference in the happiness during the epidemic. So overall, people do not appear to be less happy during the epidemic. And we have some regression models predicting subjective well-being during the pandemic. And we find that the demographic and background variables matter rather little. Income helps a bit. We have a personality measure of risk tolerance, which tends in general to increase your subjective well-being. If you have a positive attitude about distancing, you think it would make a good policy and such, that tends to increase subjective well-being. Net of that, distancing behavior actually increases your subjective well-being a little. So that suggests that whether or not you agree with the policies, behaving in a way that is aligned with authoritative recommendations does have a little bit of a social glow for you. Importantly for our purposes, the emotional costs of distancing substantially reduce satisfaction. And the casual civic ones seem to hurt the most, which was something that surprised us, and I'll come back to in the conclusion. So here are the regression results. Our dependent variable is that 2-item scale we talked about before. We start with our demographics as a baseline model, and you can see that income is helping, and people who are risk-seeking tend to be a little happier. We go on to adding in the positive attitude about distancing. We see that makes us an independent extra contribution. Our R-squared pops up from 0.05 to about 0.09. And we've got, these are standardized regression coefficients. This will put attitude just over the line into the kind of important zone for those with risk and income being in the moderately important zone. They're not much changed by inclusion of the behavior, by the way. Their influence continues separately. Next, we add in the behavior. So do you do distancing? How does it make you feel about the world? Well, a little bit better. The other variables their effects are very little changed, although a little bit of the attitude flows into the behavior. So, and our R-squared has crept up to 0.09. And then finally, we add in the emotional costs that we were originally interested in, and we see that result about the casual or civic behaviors having a quite substantial effect. It is tied with income for being the most, the strongest effect in the model. The other social deprivation ones have a significant effect, but it's very much smaller. Again, I'm going to return to this issue in the discussion. But life is complicated. So what if the impact depends on the norms and the behavior? So there is a very large statistically significant interaction. And they give us several combinations. So we have the aligned legitimacy combination. They're the happiest people. They embrace pro-distancing norms and practice high distancing behavior. So that gives them, they're getting a 7.2 out of 10 on our combined quality of life scale. At the other extreme was the saddest combination, which you can think of as coerced correctness. They embrace anti-distancing norms, but practice high distancing behavior. They are down at a 0.51 out of 10 on quality of life measures. In between, there are the contrarians who embrace anti-distancing norms and low distancing behavior. So they're consistent, but against the advice of respected authorities and such. and they come out with a 5.9 on the quality of life scale. And in between, also, we have another group who are what we might call falling short. They embrace the pro-distancing norms, but practice low distancing behavior. They come out with a 5.7 on quality of life. These are predicted means based on the regression analysis with all the other variables in the model set to their means. So our key conclusions are that people who report social distancing are more satisfied than otherwise similar people who do not. The emotional cost of social distancing is heterogeneous. Some dislike it much more than others. And disliking the casual or civil aspects of social distancing seems to have a bigger impact on quality of life than disliking the less casual aspects. We suspect this is because people go to a lot of trouble to ameliorate the network and family things. We all know people who enjoy family meals or family parties through Zoom and other such methods. And so it may be that it is easier to work with people with whom you are in constant contact about how to maintain your social life even over the internet. The other thing that was particularly striking in the results was that interaction where we were seeing that people whose views and practices were aligned with the strong public recommendations about distancing received a substantial quality of life boost from that. And other people were in less advantageous positions there. I think that's all we wanted to say today, right? Okay. Okay, cool.
Okay, many thanks for your presentation. Are there any questions from the audience? You can post it in the chat or raise your hands. Kelsey has a question. Kelsey.
Yes, hello. Interesting work. I'm very curious about seeing these results in more detail, so I'll look at the paper. One thing that I'm interested in as well is if you've looked at interactions between age, for example, or relationship status. I imagine that singles or the young people who have been found in other research to have been disproportionately impacted may have been, so that may be the case here, that they have a challenge with the distancing behavior. So have you looked at interactions?
I think actually, in some ways, what you're asking is really more, have we looked more into the roots of the emotional costs question? Yes, we are starting to, and yes, you are right that it looks like being in a relationship is a helpful thing, although there is a surprising amount of variance in that. It may be that being cooped up with somebody when you're really not quite getting on with them is actually a big minus. It's not always easy to find new places under these circumstances. The age question is an important one, and you're quite right. We should probably look at those interactions. The age effects were surprisingly small. It may be because they became much more prominent over the summer as it became clearer and clearer that young people were at much reduced risk from the COVID, but were being treated as though they were at very high risk. So it may be that we need an interaction with age and with time to bring out the kinds of issues you're talking about.
Thank you. That's helpful. The other thing I would say is, typically you want to allow age to have a nonlinear relationship with subjective well-being, and categorical may be even more relevant in this case than, say, the quadratic, which is fairly typical.
Yeah, either would be fine, sure.
First look at the quadratic didn't suggest much was happening here. But
Okay.
it well wants looking at again.
And it needs to be documented.
Yeah. Okay, thank you. Martijn, I'm finished, so if you want to look for other questions.
Oh, okay. I think that you didn't hear my question. Okay, is that right?
We did not hear your question.
No. Okay, sorry. I had a question of over 1 minute, and I think I was muted. So I will ask it again. So I was very interested in the interaction effects that you showed of the different groups. So amongst others, falling short group. And I was wondering whether you have any information about the socio-demographic profiles of the group. So
we can certainly do that. And that might be illuminating. I don't think that there are multi-way interactions there, but we can certainly look at the demographic profiles and see what they're looking like. I'm particularly interested in the ones who think pro-distancing and aren't doing it.
yeah. I think and that is also what I wonder. Are these people that want to pro-distance but can't, or people who want to do it but in the end forget about it?
Yes. And since we live in Reno, we know there are lots of people who don't think they should gamble but do anyway. So the gap between the aspiration and the performance, I think, is probably in general a bit of a stress on quality of life. But you're quite right. It might be illuminating to look at those demographic profiles.
Now, the simple effects of demography are already controlled. The interaction controls all the things we showed you in the table.
Yeah, indeed. Many thanks. Are there other questions?
Actually, we have a slight comment to make. We included a bunch of racial prejudice questions in one of the surveys, 1,000 or 1,200 people. And we found the usual finding that there is very little of it in the United States. There's very little in any Western country. So we have a paper on that showing details from the World Value European Value Survey. So an interesting question that we might try to look at is whether the people who get on Twitter are noticeably different than the rest of the population, or whether they're just a French minority that chats a lot. And that we hadn't thought of.
Yeah, I think that this is a paper question that the prior paper brings up very sharply is, are these feelings, this racial animus, confined to intense discussion within a small group? Or are they symptomatic of a wider feeling that is not in fact picked up by the surveys? And that would be something that has important public policy implications, among other things.
Yeah.
And in general, there are other cases recently where what you see in demonstrations and therefore in newspaper headlines and therefore in social media chat has jolly little to do with people's real attitudes. So
general population attitudes.
General population's attitudes. So, for example, in this recent furor about policing, we have an analysis of that. And what it really shows is several surprising things. One, that all the fuss is just by committed Democrats in urban places, not by independents, not by Republicans, not in rural places. It's an urban thing. And it lasted for a month or two. And now support for the police is higher than ever it was before, as well among the Democrats as among Republicans. So this huge media fuss and giant demonstrations throughout the world don't correspond to anything permanent, and indeed only to very transient views in the general population. We just happen to be in the field at the times that we could do it. So there's a lot of slippage between what you see on television and read in the newspaper and the general views of the population at large.
Mm-hmm. It's at least interesting food for thought and avenues for future research. We also got a comment by Runjing on your Twitter, so that the Twitter users are indeed different from the general population. So indeed worthwhile, I think, also to research in future research. I would like to thank you. We have to move on to the last speaker. Many thanks for your very interesting presentation, and I'll make you attendee again, and we will move on to Ron Anderson for the last presentation. And yeah. Hi, Ron.
Hi, can you hear me?
Yes, I can hear you clearly. And we can see you as well. And your presentation is also visible. So.
Okay. I'm Ron Anderson. Paper is on suffering. And this image is a pandemic game. This image shows it's not really a game. We've nearly 25 million ill and 1 million dead from the COVID-19 across the globe. I'm going to present the paper in 3 parts, beginning with the past, and then the present, the pandemic, and then thoughts about the future. The Black Death showed us that horrendous scapegoating, disinformation, and even massacres of minorities can happen from a pandemic. The Ebola outbreak showed that not only do people die from the virus and the disease, but because vaccinations for other diseases are halted, we have many secondary effects. Thirdly, the poor are more vulnerable to pandemics due to unsafe conditions, poor health care, and so forth. And finally, there's a recent study that shows in the past 50 years, looking at the smaller epidemics that have happened, they have all led to distrust among the young adults. So there's a serious solidarity issue that comes out of pandemics. If you look at over the past 15 years from the Gallup World Poll and looking at their negative affect indicators, there's this surprising but steady rise in all of these negative affects over time. The negative affects are worry, stress, pain, anger, sadness, and for each question they ask, do you feel a lot, most of the day, yesterday? So it's a serious matter of negative issue that they experienced the day before. And for example, worry went from 34% to almost 44%. So at least 8 points for the global picture. And now moving to the present, I analyze suffering in 3 ways. Physical suffering, already talked about that. Mental suffering, anxiety, depression, worry, loneliness. Collective suffering, which is hurt from social forces underlying any of the following 3 types of cultural violence: unjust societal prejudice, inhuman socioeconomic oppression, and inhumane pandemic policies. So what I'm defining as collective suffering is what a lot of people call social suffering, things that come from from negative aspects of society. Most of the research that I found in mental suffering comes from the United States and Great Britain, but I'm going to talk about findings from other countries as well. And most of it measures stress or anxiety or depression or all of the above, and loneliness. Sometimes happiness is used as a proxy for mental distress, because some studies have found a very negative relationship between the two. This is a graph of the United States only, but it's taking 2 of the negative affect measures that I talked about in terms of the global negative affect trend for the world. And as you can see, between last year and the beginning of the pandemic, there was a sharp rise in negative affect for both worry and stress, almost 20 points, in fact, over 20 points for worry. Then there's pretty much a steady, slight decline during the pandemic of these 2 negative affect indicators. And this is data from the US Census, their new Pulse survey. It shows mental disorders and how they spiked in the pandemic. And then after the pandemic, rose slightly, but steadily upward, which is, you'll see in a minute, is very different from Great Britain. But the measures are surprisingly negative in terms of whether or not you have experienced anxiety in the past week or serious depression, or both. This is a breakdown of those indicators by demographics, age, gender, and race. The biggest difference is by age. You can see for the 20-year-olds, they're 3 times more likely to experience mental distress than those in their 80s. Women are more likely to feel anxiety or depression than men, and Blacks and Latinos are more likely than whites and Asians. This is a different data set. This is the NRC General Social Survey showing loneliness more than doubled before the pandemic and the beginning of the pandemic. Lack of companionship rose also, but not nearly as much. But it indicates that loneliness is more than just lack of companionship. Now, moving from the US data to UK data, this shows from the Office of National Statistics their anxiety disorder measure from pre-pandemic rising to during the pandemic, but then after the pandemic continues, it declines slightly, which is due probably to this difference, which you can see a typical confirmed cases graph over time comparing the US and the UK. And you can see the US has over twice as many cases, confirmed cases per million, which may explain the rising anxiety in the US. Other studies from the UK providing similar results include the HLS panel, which confirmed a 10-point jump in April. A survey by Reddy and Daniels found that vulnerable groups are much more anxious and depressed. And a study by FOA using YouGov polls found that positive affect increased in the first 4 months of the pandemic, but negative affect also increased to some extent. From other studies, we find that Ireland CSO found a 20-point jump in feeling downhearted or depressed at least some of the time due to the pandemic. France did not find that exactly. A nationwide panel study found that lockdowns mostly created a reduction in negative affect, except for Paris. So Paris is not always what it's cracked up to be. China, Yang and Mao found a steep drop in positive affect minus negative affect. It was greater in the Hubei province, which was the epicenter of the pandemic, but was less among those well-informed about the nature of the pandemic. So this shows that what people know about the pandemic in terms of facts sometimes may shape how they feel. A study was done by Grayling, Rousseau, and Adhikari. 2 papers on this were given earlier today at this conference, comparing New Zealand, Australia, and South Africa. And they found all 3 countries had a decline in happiness with a rise in stress from the lockdowns. Sibley and Associates in New Zealand found a major rise in anxiety and depression. Fetzer et al. In an ongoing 58-country online survey concluded that people feel more mentally distressed when they feel their government's approach to lockdown was insufficient. So we find this interesting conflict. Many feel distressed because lockdowns curtail their freedoms, but many also feel distressed because the lockdowns do not curtail their freedoms enough. So the challenge for any government then is to find the best balance. What most countries I think fail in is to really invest adequately in public health education. Now, collective suffering. As I already mentioned, I defined collective suffering in terms of these 3 major categories of cultural violence. The question is what people are most likely to collectively suffer from. And I've outlined some categories of populations experiencing collective suffering. First one is slum dwellers lacking safe water, sanitation, and safe distancing during the COVID-19 pandemic. And at least 900 million people are potentially affected by that. Secondly, poor facing hunger or extreme food insecurity due to the pandemic. Another large population in the world. Third, women and children and men facing increased violence by armed groups during the COVID-19. and increasing violence during the pandemic already. And this is likely to continue. Fourth, Black, Latin, and Asian Americans are at risk due to discrimination, threats, and segregation, which is consistent with the earlier paper. 5, refugees and migrants who face greater discrimination and vulnerability due to COVID-19. And another group is those affected by famine. Largely driven by a locust plague and climate change last year, famine started in Central Africa and Western Asia. These forces with COVID-19 are creating a new pandemic famine. Farmers are hit by COVID from issues not just that were occurring last year. Fragile food markets are collapsing. Armed conflicts are taking advantage of the pandemic. Dwindling humanitarian aid, remittances are drying up, and massive unemployment. These are the countries most affected by this acute hunger from the famine: Yemen, DRC, Afghanistan, Venezuela, and Ethiopia. What can we expect from the future? What do we know? This pandemic may last for many years, so we need to learn to adapt and try to avoid mental distress. COVID-19 vaccination will not be a panacea. Vaccines are likely to create havoc, especially because of anti-vaxxers and a competition for vaccines. Some countries like the US will lose social solidarity. Research is needed on the effect of the pandemic on social capital, especially how to extend the surges in kindness evident early in lockdowns. I know this talk has been kind of depressing and down. I want to leave with you a finding that is uplifting, and that is that in many catastrophes, global in the past, there have been surges of kindness evident. And in fact, in this pandemic, there have been surges of kindness evident, especially in the early lockdown. But I think to some extent, there's still a level of kindness higher than normal within this pandemic period. Finally, research is needed on suicides during the pandemic. So far, we don't have up-to-date statistics on suicide, but we need to know to what extent the pandemic is generating more or less suicide. Concluding thoughts. 1, words or numbers alone do not convey the devastation of the pandemic. Those already suffering suffer the most, but research confirms a huge loss in global mental health, and we should not diminish that. Millions, if not billions, are hurt by the cultural violence and collective suffering of the pandemic. And finally, pandemic undermines social capital, but it may be offset to some extent by social capital of a different sort, increases in kindness. And that's the end.
Well, many thanks for your interesting presentation. We'll move on to the questions, and we have one question in the chat box for you at the moment from Ondrej. And Ondrej is asking, I was just about to ask about suicides. Anecdotally, many suicides are linked to COVID. Can you reflect on that?
Can you hear me?
Yes.
Okay, I've lost my screen and I can't read the messages, but If you can hear me, that's great. Well, people experience despair as a consequence of anxiety and depression, things that I pointed out are increasing during the pandemic. So on the basis of that, I would expect substantial increases in suicide. But opportunities for suicide are probably fewer, and that if people are staying at home, their options for committing suicide are probably less. And in fact, there may be other advantages that offset, and staying at home that might offset the propensity to suicide. There's been some examination of suicide as revealed in Twitter. That is, to what extent do people look into suicide issues on Twitter? And so far, from my examination of that data, it's not clear that there is a clear trend one way or the other. But the Twitter data in this case is not nearly as important as actual official records of suicide. There is one study of from India where they examined newspaper articles reporting suicides during the pandemic in India, and about a third of the suicides that they examined during the pandemic did show that issues of the pandemic, lockdowns, loss of contact, and so forth, were important as the cause of the suicide. In fact, India has had probably the worst experience with the pandemic as any country, because when they locked down the country initially, they banned travel at the same time. And there were millions of people caught unable to get to their homes because they couldn't get any transportation. There are reports of many people walking hundreds of miles to get home. And during that lockdown, they haven't had any income, and so there's a real hunger issue in India. Any other questions?
Any other questions from the attendees? Yeah, Talida, I will give you the floor.
Can you hear me?
Yes, I can hear.
Prof. Anderson, wonderful presentation. Good to see you. I hope you are well. Just some comments that we found in South Africa, or one from the tweets that we've analyzed, and definitely we've picked up a lot of increase in loneliness. We picked up anger. So emotions of distrust increased incredibly since the pandemic. And from the medical side, we have statistics where we find that suicides has increased, and also prescription medication for depression has increased, depression and anxiety. So that's definitely something we picked up from the South African side.
Well, that's very interesting. Thank you very, very much for that. South Africa is definitely problematic, and I think it's probably similar to India in some respects in terms of the lockdown affecting particularly poor people. I'm impressed by what New Zealand has done, because everybody is impressed with what New Zealand has done in this pandemic. So it's been interesting to look at evidence of both distress and positive feelings that you found in your studies from New Zealand.
Many thanks for your question, Talida. Are there any other questions? What I was wondering when I hear your presentation is, like, you very nicely show on how people's socioeconomic position basically moderates the relation between, like, the lockdown and their suffering or mental distress. Have you any information, or also whether personality may play a role in moderating this relationship? Whether some people with certain personalities suffer more?
No, I haven't run across anything that looks at that. Well, I think there was one study that looked at whether or not you're morose or positively oriented in life, and I would think that those who don't have a positive outlook in life are feeling less vulnerable. I haven't seen any studies that tried to look at differences in religion either, but I would think that those who have a sense of wholeness or character strength, which might come from religion or positive philosophy, would have less difficulties with anxiety and depression.
Many thanks for your answers. So something to explore. Are there any other questions? Maybe a final one. I don't see any in the chat box. So then I would like to thank you much for your presentation.
Thank you.
Yeah. And I would like to thank all the attendees for being with us and being present today. The recording of the session will be available on the ISCOL's website. It probably will take a few hours to upload it. But you can access it via the ISCOL's website. So we start tomorrow again at 8 o'clock, I think, or 8:30. Please check the timetable. So that's West European time. For those who are still asleep at that moment, again, you can watch the recordings back on the ISCOL's website. Then I wish everyone a very nice day or good night. Thank you.